I'm David Nicholson, I'm the Trust Chairman. It's very important when you're trying to improve services for patients that you have clarity about what we expect both from the board, the management and the staff in terms of their interactions with patients. And the great thing about the Forward programme is it sets out very clearly all of our expectations, how we work together to improve services for patients. The really important thing about healthcare is teamwork. And all of the staff that I've met have talked about how important it is to work with colleagues, to work with other professionals, to work with management, to enable that teamwork to work in practice. And what the Forward programme does, it gives you a mechanism to bring that teamwork together. If we want to make the kind of changes that we all want to make to improve services for our patients, using the Forward programme as a mechanism to help us do that is really important. That's why we're so committed to it as a board, and that's why we see it going forward consistently to improve services for patients. Winter is going to be a very challenging time for these trusts, undoubtedly. In fact, it's going to be a challenging time for the NHS overall. And we're working really hard to make sure that the staff have the facilities and mechanisms they need to improve services for patients. But even with all of that, it's going to require significant working on a team base to make it happen. The kinds of behaviours that underpin the Forward programme will be crucial to that success. So doing what we say we're going to do is going to be important in terms of a guarantee to the public, but also to make sure that all of us inside the organisation help and support each other in the challenges that we face. Listening, learning and leading is going to be important behaviour for us. If you think about the lessons from previous winters, if you think about the things that we will learn and understand from other health professionals, other parts of the healthcare system, and then doing something about it, is going to be very important to ensure that we provide good services to our patients over winter. No delays every day is an obvious one in terms of managing the challenges of winter. And that just doesn't mean people waiting in accident emergency. That means all of us doing our bit to ensure that the system operates as seamlessly as possible for patients, so we can move patients through the system as quickly as possible so they can get to the right clinical decision maker at the right time to enable the best possible services to be provided to them. And working together and celebrating together. Teamwork is at the heart of all of this. So working together is obviously a behaviour we need to all exhibit during the period. But also when things go well, we should celebrate it. We should support our colleagues. We should say when people have done a really good job in very difficult circumstances. If you take those behaviours together, we've got a real opportunity by using them on a day-to-day basis, being accountable to each other to enable them to happen, to really improve services for patients and to deal with the real challenges that we'll all face over the coming winter.